I am here representing the Preventive Health Partnership, which is made up of American Diabetes Association, American Cancer, and American Heart Association. The targets and indicators delineated in the discussion paper, I think, will help reach the primary objective of 25% relative reduction in the overall mortality from NCDs by 2025, and will motivate timely action on NCDs around the world. We also endorse the establishment of an effective monitoring mechanism that can be implemented in all countries regardless of economic status.
Glaringly absent is a focus on health systems more broadly and on treatment and care. There's a whole other end of the spectrum when it comes to NCDs globally and how it's affecting people living with those diseases, including heart disease, diabetes, cancer, and chronic respiratory.
You're representing the American College of Cardiology, our 43,000 members around the world, as well as the NCD Alliance is strongly advocating for the original 10 targets around NCDs to be implemented either at the WHA or by the end of this year. We feel the 25% reduction target should certainly be put through during the WHA. The risk of inaction at this pivotal juncture is great. We have 15 years of policy essentially to set here. The burden of non-communicable diseases in the developing world is growing quite quickly by the minute, and if we take appropriate action now, we'll save ourselves many lives and a lot of money. And finally, just to point out that it's very important to have a multi-sectoral approach.
Prevalence of major NCDs in children and adolescents, including cancer, cardiovascular disease, chronic respiratory disease, diabetes, childhood obesity, and mental illness has reached epidemic proportions. The majority of preventable behaviors that lead to NCDs start during childhood and adolescence. Failures to implement evidence-based child survival efforts lead to significant preventable NCD morbidity. We support the global health resolution for the prevention and control of non-communicable.
There was a lot of recognition after discussions last week, but even before, on the importance of, for instance, use of tobacco and secondhand smoke exposure of children under 15. However, there were very few reliable measurements of that. If the Academy has some baseline figures or indicators that are used widely internationally, very much help inform the WHO process because people recognize the importance of youth and adolescents.